Greetings, I'm Vinita Aurora. I'm the Education Director for Costs of Care, and we are live here on third Thursday for 30 minutes for the Teaching Value in Healthcare Learning Network with our special guest, Jessica Perlo, who's the Senior Community Manager at the IHI Open School, who's going to be talking about the IHI Open School and particularly their Open School Change Agent Network and how they've motivated students to really drive forward change and value. So before we get started, I just wanted to remind everybody a little bit about what the Teaching Value in Healthcare Network is. So let me switch over. So the Teaching Value in Healthcare Learning Network is bringing together educators together from all across the country to advance stewardship and health professions education. And there's three components. There's monthly webinars, which you're attending right now with on-the-ground and national leaders. And so we're going to, Jessica is going to be highlighting really a national innovation for us, but we also hope that it will help those of you on the ground implementing in your own area. There are also discussion groups, as well as ongoing discussion forums to facilitate sharing ideas, asking advice, and advising one another on innovations and implementation. And this is through our Google Learning Network, as well as tools for educators on our shared Google Drive. This includes shared educational materials from all across the country, including publications and presentations that are accessible to anyone, as well as mentorship. We do provide individual and group mentorship from across the country with experts. And so if you have any questions about those, you can contact us afterwards through the Teaching Value and Learning Network. So today, our objectives are to share an innovation in teaching value, as well as discuss practical components of implementation. I think from being on these webinars for the past several months, I think that that's what we glean most is how do we really take home and think about how to implement something by next Tuesday, which I know is a motto the IHI uses. And then troubleshoot challenges and brainstorm how to make innovation sustainable. So as I mentioned, our guest speaker is Jessica Perlo. Jessica is the Senior Community Manager of the Institute for Healthcare Improvement's Open School, an interprofessional education program that provides health students with the skills to become change agents in healthcare. She holds a bachelor's in science from University of Vermont and an MPH from Boston University School of Public Health. She's trained in community organizing from the Harvard Kennedy School of Government and facilitates leadership from the Interaction Institute for Social Change. For over 8 years, she's worked with the health professional program development and quality improvement efforts at both Brigham and Women's Hospital and at the Institute for Healthcare Improvement, and she's charged with leading IHI's efforts to mobilize over 30,000 students to take action to improve the health of their communities. So we're really pleased to actually have Jessica join us, and so I'm going to turn it over to her at this point to really talk us through some of the nuts and bolts of her innovation, and then we'll open it up for questions. Thank you.
Thanks, Vinny. It's really exciting to be a part of this, so I really thank you for allowing us to share some of the work we're doing here at IHI. So I know folks might know the Open School, or you might not, so I'd like to share just a little bit of an overview of what we do here, but I'll keep it brief. So this is our strategy here at IHI to work on quality and safety, innovation and improvement, but also to innovate and partner with organizations and communities to improve health. And so we work in quality, safety, improvement capability, person and family-centered care, and then triple aim for populations. And we do this in a variety of different ways through different partnering and convening of folks at our forums. But one of our efforts that I help to lead here at IHI is the Open School. And our mission is to change the way health professional students are learning, so they're not just learning how to deliver care, they're improving it. And we find that a lot of organizations have students as an untapped resource to drive change. So we actually celebrated our 7-year anniversary this week. And when we started the Open School, it was based on this idea of offering students of health professional disciplines resources that they don't currently necessarily have in their curricula. So the content are these free online courses in all of the topics that I mentioned IHI teaches on. They're absolutely free to students. They're free to faculty and deans and residents, program directors. The idea is just to remove the barriers in between folks in learning this information. But we also facilitate community around our chapter network. So chapters have sprung up across the globe. And we help to facilitate local improvement efforts through a few different techniques, and I'm going to dive into them very quickly. But one of the things we've seen is just this tremendous uptake. You know, we knew people wanted these courses, but we had no idea that over 2 million were going to be completed by more than 300,000 students, and this is across the globe. And we're finding universities and faculty are using our courses within their curricula, which they're welcome to do, and many folks are using it to just augment the curriculum or to supplement it so that there's this basic QI literacy in their learners. But Don Berwick is our advisor, and he encouraged us to think about this incredibly untapped resource we have in having 300,000 students in our network, and to imagine what it would be like to have the collective improvement of health be the focus of this kind of flywheel for change. So we started this improvement change agent network to improve community health through community organizing techniques. And we created a course just like our other online courses, but this one is a little bit different because it's not just these online videos, these short videos. There's also weekly coaching calls and sort of this broader network of folks to tap into as a resource in the learning. So the pedagogy itself is over 8 weeks, some video lectures, a coaching call, and then folks applying what they're learning in their local settings. And we found in this, we've been testing it over the past year and a half now, we found more and more faculty are using it, and so it's become sort of a train-the-trainer resource. The science of it incorporates improvement science, so systems thinking, with community organizing. So we worked with Marshall Gantz at the Kennedy School to help us create, and his protege, Kate Hilton, who works at Rethink Health, to create this community organizing curricula, and also subject matter knowledge. So when we say health, can we make sure that folks know what we mean is something that's inextricably social, not just a medical matter. So there's a lot of learning over these 8 weeks in these 3 topic areas. And I can share with you just a few of the projects that have come through in the past few offerings of the course. So just to give you a flavor of what we've seen, we've had students working with Richland County in South Carolina on improving volunteers who do the health screenings, improving their retention, and getting more students in to volunteer. We've had students in Florida working with eligible at-risk young mothers on applying for federal assistance programs. And then a student here, actually he organized in Massachusetts, and he just organized his friends and went to grocery stores and secured over 1,000 pledges from the community, from folks committing not to text and drive. So this kind of shows you a little bit of what they're working on. The uptake has been incredible, but I think what we're seeing is that students have a better understanding of health. They are building relationships in their chapters and on campus. Their campuses are healthier, where there's now resources around sexually transmitted diseases or mental health, and there's new relationships with the community organizations. So one that I wanted to focus on was our Portland State University team, and they worked on choosing wisely. So we'd had this great relationship with you, Vinny, and with Neil, and we knew that there was an opportunity for students to work on the 5 questions, dissemination, and just kind of awareness raising earlier on, right? So that students were getting involved. before they even enter into the delivery of care. So they formed an interdependent leadership team here, focused on getting the Choosing Wisely topics included in their curriculum, getting other people to commit to being involved and disseminating with them, and then using these community organizing skills. And these are their slides. So they were able to build a leadership team and piloted the awareness campaign on campus. And they found that it was really helpful to spread the materials, but they were having a hard time getting people to commit to sharing data on, were the questions asked, was it effective? Some people they were working with the local student health center, and there was just a little bit of resistance from the leadership there to, hanging the posters, and it just wasn't smooth sailing. And so they really had to dig in and think about how they could relaunch this work so that it was something done with the student health center and with their faculty. So they focused on a shared purpose, and they came together, and they you can see some pictures from their experience here, but so that they were building a shared purpose together. So they'll be presenting actually on some of the work they've done today in our WIHI, our radio broadcast. So folks are welcome to join if you're not listening to this later, but you can also listen to the WIHI later.
That's terrific. Jessica, I want to thank you for providing such a lovely overview. What I would love to hear more of is actually, we've talked about the students really driving change. And I work in a medical school, and, we obviously have faculty in our medical schools too. And so much of student initiatives and kind of bringing stuff from the grassroots really also depends on the faculty involvement and the faculty advisors. And I think we have a lot of faculty advisors in our network. And so I'm wondering, what was the role of the faculty advisors? Did your students, seek the faculty advisor, or were they basically working directly with deans, or how was their bridge between student, the IHI, ICANN network, and the faculty sort of bridge?
Yeah, thank you. So we have a few faculty advisors here who just constantly remind us of how it feels like when there's sometimes a tension between students' interests and the priorities of an organization, and sort of you get folks who contact you and who want to be a part of the work you're doing, and you already feel overcommitted, and you're worried you don't have the time to mentor or guide students, and that's a real challenge. So. So we've found our whole goal is to take the burden off of the faculty, and then there's also this tension between the interest of the student and maybe the priorities of the institution. And so hopefully some of these skills can help them to develop communicating shared values and identifying projects that are mutually beneficial. And then on our end, just trying to help with one or two conversations early on with the student as a touch point to help with that mentorship piece. And they don't really need that much. So I think most of the time what we're leaning on faculty for is helping them to remove some roadblocks, to make some relationships for them. And it's actually a lot less of a lift than it might seem at first when they're asked to mentor and lead a project, which can feel separate from your own goals.
Yeah, no, that's great. And so it sounds like, I'm one of in full disclosure, I'm one of the faculty advisors for IHI Open School chapter. I will definitely second that with all the resources you provide, it isn't a huge lift because I think that you're kind of more of an advisor as opposed to spearheading the entire program or doing the primary teaching. And I know that, flipped classrooms and modules, web modules are all the rage right now in undergraduate and graduate medical education. And so one of the things that I was pretty intrigued by was in the ICANN model, in addition to the improvement science, which I think I've always thought of IHI as the leader in providing teaching around improvement science and what the Open School does so well. I was really intrigued by the idea that you're training students, health profession students, in organization leadership. And so can you comment on what that is and what does that mean to the students and how you're able to impart those skills?
Yeah, I wonder if I can't pull up a slide or two to show you, but I can just send those along as resources for folks.
Yeah, and we post them actually in the Learning Network as well.
Oh, great. Okay. Yeah, but community organizing was a new science for us as well, and I think one of the ways we looked at it was through Deming's system of profound knowledge. So Deming was one of the founders of the improvement movement, and what he said was that in order to have change, you need a few things. You need an understanding of how learning grows over time, and so that's what we do with improvement science. You need subject matter knowledge. You need to understand that systems speak, but they speak largely through variation. So how do you identify changes to test and implement? And you need to understand the psychology of change, so how behaviors impact the outcome of your effort. And so that's really where we knew we needed some skills, we needed some content. And so behavior change and relationship building and getting people to commit to, when they're already overcommitted, to help you with your efforts is a skill, it's a craft. And so a lot of the community organizing skills are based on these leadership principles, and leadership as defined by distributing that power and making sure that you are there's a shared purpose that you're accountable to. So it's kind of this different model that a lot of times it's not intuitive. And then we do this through the 8 weeks of learning. We focus on building relationships, how to craft a public narrative, so your story of self, of us, of now, so what called you to do this work, what unites you to the people you're speaking to, and what's the opportunity at hand that everyone can take advantage of, so your call to action. So that's kind of the distilled version of some of the skills of community organizing, but it's pretty robust, and it's pretty incredible to see these techniques that Marshall Gans taught us, that he used with Cesar Chavez and the farm workers' efforts, and with President Obama's campaign, have been highly effective vehicles for large-scale change.
I love that, really thinking about skills from grassroots advocacy, other public sectors, and bringing that to our healthcare professional students. I'd be curious if you can talk a little bit about some of the challenges with this approach. It's a massive undertaking. It's a virtual network of students, and I'm just thinking, like, students are really busy, and you've talked a little bit about, you've obviously got to have the right students, the right faculty. Is there like some when you think about the challenges others have faced, are there some critical ingredients for an institution or a program to think about? Well, we're ready to make this step, and what would be your advice to somebody who contacts you? Be like, I'm thinking about starting with an ICANN chapter at my school. I'd just be curious how you walk them through that process.
Yeah. I think you raised such a good point, because it can be, the real learning is when you're doing, and we find this with quality improvement. To learn QI is the kind of famous saying, and I think it's because when the rubber hits the road, there's all sorts of resistance and things that bubble up that you don't anticipate when you start a project. There's also kind of a huge leadership learning curve in looking at what calls you to this work, what are your own motivations, so where do you need to focus some of your work to be more effective communicators, or more able to distribute leadership, or just better at not being like this wet back. It really showing just a little bit of drive, a little bit of passion, and kind of harnessing that energy. So focusing on your bright spots, and leveraging them to lead, and that might mean kind of giving up a little bit of what you thought it might look like in the end, because it is something that's hopefully reflective of everyone's values. And just a willingness to learn. There's this sort of it might be a little cliche, but Marshall always says, who discovered water? And the answer is, I don't know, but it wasn't a fish. And sort of, it's this idea that you can't really know something when you're in it, and you need to have this practice. And so this is a practice. This is all one big practice. We're all learning together. So there's sort of this willingness to experiment with the techniques that are presented that I think contribute to really meaningful changes, both on the learning outcomes and also in the patient outcomes.
Great. I'm just going to reiterate, I don't know if others at home are experiencing this, but you broke up a little bit, Jessica. You're fine now, but it sounds like there's that intrinsic motivation that people have to have. So, and that's going to be something that, is sort of intrinsic to the culture. So willingness to learn, a willingness to innovate. But then also on your end for the IHI, it's also an open dialogue. So it's not like, here's our program, but there's also functional adaptation and implementation science, so that you're really working with the team to implement locally. So maybe all they can do, like if they're very busy, is do a lunch with a module, and that would be okay. And maybe they're not ready to move on to some of the group that you're highlighting as these change agents who are doing choosing wisely work and kind of actually bringing down the bottom line. And so I think that's nice, because there's like a variation by which you can kind of engage. So that's great. We actually do have one question from the audience, and excellent overview and great slides describing the program. One question I have is, what barriers have you seen students and faculty face in implementation, particularly around engaging the community? I think that's a great question. Some of your projects did have community outreach components, so I don't know if you're able to comment on either barriers or maybe strategies to overcome the barriers.
Yeah, that's a great question too. I think this is a new practice for so many of us who are used to working in your silo. So there's engaging across the boundaries of your own health discipline, and then there's engaging outside of the walls of your institution, and both can be a challenge. So I think overcoming the inertia of approaching people, that is really scary. And so what we try to have folks do is practice failing. You're going to ask people for commitments, and they're going to say no. And that's okay, because you only want the people that are really committed. And so I think that's something that comes up a lot. And then just identifying, there's sort of this idea of you're organizing with, not for. And so I think a lot of times we come in with an idea of what we think communities need. And it's sort of this needs-based approach versus an asset-based approach, where people will tell you what they want, and you're working with them. And so involving community members on your leadership team so that you're doing something together, that is the idea. And that's sort of two of the learning pieces we've discovered.
That's great. I love the practice failing. I'll have to use that in my own mentoring and advising. I think that's a really useful skill for resilience building. And so I also wanted to bring up silos, because you mentioned silos, and there's silos. Silos are at many levels. Institutional silos and then departmental silos. I think we see a lot of silos in the health professions, physicians, nursing, pharmacy, and I kind of look to you guys as the leader in terms of breaking down those silos, in terms of having these health professional students work together. And so I was curious if you could comment on, the interprofessional culture that you created and what kind of gains you've seen in those areas. Any projects that have particularly successfully involved students from various different professions.
Yeah, I think that can be a real challenge. There's a ton of resistance to working outside of your discipline, I think, especially because that's not how we're trained. So oftentimes we find in our projects that this is the first time a lot of our students are working interprofessionally. There are tons of challenges to this. Even having those relationships, knowing who to approach, how to approach them, how do you even identify folks that want or care about this, not knowing the skills that another discipline brings to the table. I think that's a real barrier, just understanding roles and responsibilities and how to leverage one another. We try to address a little bit of this in the course, but I think it's definitely a real challenge, and where I think there's a lot of exciting learning in our projects. Georgetown University is one of our chapters that I think does this exceptionally well. So it was started by a then medical student who is now he's actually a VA quality scholar, but he became chief resident and stayed involved with the chapter. And they just leveraged each other for their skills. So they had nursing students involved, they had pharmacy, they had public health, they had a lot of medical students, and so they would come together. So just having a dialogue once a week or once a month or whatever works for folks, alternating campuses so that it worked for everyone and wasn't too based like at the medical school, for example. Having buy-in from the healthcare sponsor makes a big difference. So this was they identified projects that mattered to their institution. So they were working on ventilator-associated pneumonia, central line infection, things like this. And so the mandate, if you will, was coming from the healthcare institution local to them, that they were all focused on trying to improve and deliver care. And so there was some unifying project themes. But yeah, those are just some of the bright spots we've seen, and what they've done is just they've had incredible tenacity, because it's really hard to identify folks from other disciplines and to work together and to know how to leverage one another.
Great. I know there's a lot more questions coming in, so I'm going to just turn to our audience questions. The next one is actually, again, very concretely thinking about a chapter that the IHI's helped that overcome the challenge that they face. How would you say your role is in helping troubleshoot an issue? And if you have a specific example, we'd love to hear it.
An example of how coaching has helped them overcome challenges?
Yes, exactly.
Yeah, it's funny. Sometimes we don't. There's this limiting factor of there's so many students and so few of us, and so that's actually been a good thing. Sometimes they figure it out on their own without you interfering, which is kind of incredible. But also I think we use the classic diagnose, intervene, sort of the coaching structure, and it's just sort of I'm trying to think of what most of our coaching centers around. There's this a lot of times what comes up is not setting a name statement. They don't have a measurement strategy tied to what they're trying to do. So how good by when? Like, how are you going to know that what you're doing is affecting anything at all? And so it's just very simply just asking those sorts of questions, which I think coaching is really important, and it doesn't necessarily need to come from an advisor or us. I think they can get it from each other too. So peer coaching is incredibly effective. But yeah, I don't know if that answered your question.
Yeah, no, I think that's a great example of if you build it, they'll come, right? And I mean, having been at the Congress, the IHI Open School Congress, I do think there's value in the network, similar to our teaching value in healthcare network. People figure it out on the discussion board, and so. But it also sounds like you are reminding people to go back to their base, which I do think gets lost a lot of times. I know that when I'm coaching here and doing improvement work, sometimes you get down this long trail of working with IT or your EHR, and you're like, what are we really trying to do here? And is there an easier way to measure? And so I think those are good examples just to remind people for the basics. I have another great question that I want to throw in here. I know we're kind of close to the end of our time, but this is just a thoughtful question, actually, coming from Neil Shaw, one of the executive directors for cost of care. So he actually, and I think this is just well worded, so I'll just read it. Classically, science and advocacy exist in tension. Science is supposed to be neutral, objective. Advocacy requires a point of view. So he's fascinated by the way ICANN brings both into harmony. It's improvement science, but it's also this leadership advocacy. And you know, he's curious if you found this as a hard distinction to make, or if there's been any, if it's a synergy, or is it sometimes at odds, and what your general thoughts about how the two go together are.
Yeah, that's an excellent question, and thank you for saying that we bring it together in harmony, because I think I don't know if I'm exactly going to get to your question, but I think there definitely is a tension there, and oftentimes we come into these projects with this idea of we're doing a research project. There needs to be this, you know, this science-based, how am I going to publish this sort of
I'm sorry, Jessica.
Oh, can you hear me now?
Yes, yes, we can hear you now.
Now you're breaking up. Let me try something. Is that better?
Yes.
Okay. So yeah, the idea that people don't commit to ideas, they commit to people. So as much as you might have a great idea, it's the relationships you build and how you communicate them that's going to affect change. So science will only take us so far. There's also this incredible delay between the bench and the bedside, and why is that? And there's this thinking about that there's a science to how behavior changes, and we need to use it, and even within a 15-minute patient encounter, but certainly within education. I don't know if that answered your question, Neil, but it's a good one.
I think it did, and so I think also I really I loved your evidence of your statement about bench to bedside. I mean, I'm rounding these days, and I also do research, so I can definitely feel that tension where you don't see things operationalized in practice where you know they should be, and I think that it does take you know, even being a good clinician requires the evidence, but it also requires the advocacy, and so maybe this is a way to kind of realize those changes on a larger level. So at this point, I think unless there are any further questions from the audience, I think I would like to formally thank Jessica for joining us and sharing her experience directing the ICANN as well as the IHI Open School effort, as well as also offering to provide us with the resources to post on the Value in Healthcare Learning Network, which is our Google site that you can join. And so I know that as part of the Learning Network, we also continue the discussion on the Learning Network. So I invite everybody who's watching, or either in live or watching this later on video, to continue that discussion, as well as be able to contact, feel free to contact the IHI directly for any of their valuable resources. And so with this, I'd like to adjourn and wish everybody a happy Thursday, and see you in a month. Thank you.
Thanks a lot. Thanks for having us.